So hello, my name's Adrian Richards and I'm the Surgical Director of Aurora Clinics, and today I'm going to be talking about whether you need a breast uplift and how you assess whether you have got breast droop, which is also known in the medical world as breast ptosis. Okay, so the first thing you need to assess is really look in the mirror, okay, and you need to work out your nipple position in relation to the inframammary fold. So the inframammary fold is the fold underneath the breast. Okay, so if you place a pencil at that area, if your nipples lie above the fold, you don't have significant breast droop. You may have lost volume from the top of the breast, so you're slightly scalloped in the top area, but you don't actually have breast ptosis or breast droop. And those, in that case, the best treatment is a breast implant alone to restore the volume. You don't need a procedure to raise the position of the nipple. You can also sort of assess this a little bit, because if you see skin below the nipple, you're unlikely to have significant breast droop. That's when you look directly in a mirror. Okay. Again, looking forward, if the nipple is at the level of the pencil lying in the inframammary fold, you do have some breast nipple descent. So you have a moderate or grade 2 breast ptosis. That's how it's classified in the medical world. These patients, you know, if you have got this, you're slightly in between. Often people with the nipples lying at the level of the fold can get away with an enlargement alone and don't need an uplift. But you really need to discuss this with your surgeon. The downsides of uplift are obviously scars around the nipple and down into the fold underneath, the so-called lollipop scar. Surgery can be combined, an implant and an uplift are often combined, but many people with this sort of nipple lying at the fold elect just to have a breast enlargement because it's got much less scarring associated with it. Okay, if your nipples lie below the fold, it's more complicated. So the nipples can lie below the fold, but pointing sort of forward and down slightly, or in severe cases when people have lost a lot of weight, often the nipples can be pointing directly downwards. And in these cases, you do need, or you're very likely to need, some sort of nipple elevating procedure. The nipple distance, so the distance between the sternal notch here and the nipple, should be the same as the distance between the nipples, and this is called the golden triangle. So if the distance between the sternal notch and the nipple is too long, often associated with the nipple in a slightly low position, you will need an uplift. If you've got sufficient breast tissue, an uplift alone will probably be enough for you, but if you've got breast descent, breast ptosis with loss of volume in the bust, normally you will need the volume restored with a breast augmentation and an uplift, the skin and nipple adjusted with a Mastopexy. So I hope this has been helpful. I think it might be useful to look at the other information videos specifically concentrating on breast uplift surgery or breast augmentation surgery to get more information. So thank you very much for listening to the video today. If you would like any more information either about breast enlargement, uplift or any of the other surgical procedures, please contact us either by ringing my office on 01844 214 362 or alternatively inquire via the Aurora Clinics website.